I have the pleasure of talking to Joe Cody, who is the Associate Director of Health IT and Digital Health Policy at the American College of Cardiology. Joe, thank you so much for being with us here today. How are you doing?
I'm doing well. How about yourself, Ansley?
Doing great, and I would love if you could give an introduction to our audience.
Yeah, sure. So, thanks so much for having me. I appreciate the opportunity to get the chance to talk about this important subject. So, my name is Joe Cody. I'm the Associate Director of Health IT and Digital Health Policy for the American College of Cardiology. We are the largest cardiovascular organization in the in the world, representing over 50,000 cardiovascular professionals across the world. We are helping to advance science and represent our membership across the world. And I'm happy to talk about digital health and cardiology and to share my expertise with everyone.
Yeah, absolutely. And on that topic, so how does the American College of Cardiology support that integration of digital health into cardiology?
Yeah, so as I mentioned, the ACC has over 50,000 members across the world, and we lead the credentialing of cardiovascular professionals in over 140 countries. And part of this is through the formation of health policy, standards, guidelines. We have our JACC journals, which are publishing clinical evidence. We have a suite of clinical data registries that are tracking information, doing post-market surveillance for cardiovascular devices and procedures. We have accreditation services, et cetera. But as we know, digital health is becoming, an integral part of how cardiology is practiced. We look at some of the things that are being utilized now. We have AI assisted echocardiograms and, advanced cardiac MRIs and CT scan systems. There's robotic assisted surgeries, like percutaneous coronary interventions and the AI guided coronary assessment. So all of these are digital tools that are being utilized by our members to help treat patients. We're working to reduce the amount of time patients have in care, shifting from inpatient to outpatient settings, hoping to reduce the amount of complications. And digital health, I think, is a really important tool as we go through this process. And as we go through this, I think we're supporting the integration of digital health in several ways. And a lot of that are through our major initiatives as the college. So promoting health equity in digital health is incredibly important to the college, ensuring that these tools are utilized in equitable ways that promote better decision making and also better outcomes. Providing guidance at the point of care. Care transformation as we're utilizing digital tools is incredibly important in ensuring the workforce of the future is utilizing these tools in proper ways. And then finally, providing the CV team with clinical competencies to ensure they have the tools and information available to them so they can make informed decisions of what are the best digital tools to help treat patients.
Amazing. And I was going to ask you about some examples of initiatives that really help clinicians navigate digital transformation. Have you seen the implementation of these initiatives and how it's kind of really helped navigate that digital transformation for clinicians?
Yeah, absolutely. So, a couple things that we work on is I mentioned our JACC journals. So we have a series of journals that are published that are really constantly publishing this new data to help inform decision making and better understand digital transformation in cardiology. So, if people are up to date with a lot of those publications, you'll see all these new scientific understandings of digital health tools. We also have an innovation program that the college has developed that helps tie together surveillance and engagement, thought leadership, and then also collaborates with industry and academic institutions to help improve cardiovascular care. We are in the process and we develop regularly practical resources to help our members and others in the cardiovascular space understand the digital tools that they're utilizing. We have an AI resource center. We have remote patient monitoring workbooks and telehealth workbooks. And I think importantly, we're regularly meeting with representatives from industry to help understand the advancements in the CV space and provide with the expertise that our membership is able to afford. So that way data used to train and build these digital health tools are properly encompassed in ways. And I think a really important aspect of what the college does and what I do in my job is also regularly being involved in advocacy efforts. So everything from reimbursement to coverage determinations, to legislation and regulatory activities that impact digital health application, how it's used in the cardiovascular space, and then also ensuring that there's safe, equitable, effective use of these digital health tools by our members to best serve the patients that they're treating.
Absolutely. And, what role does the American College of Cardiology really play in helping to set those standards or guidance for digital health tools in this cardiovascular care area?
Yeah, this is a new area for us as a college, and we don't really look to set the standards and guidance per se. We're guided by
Mhm.
science. So we look to see where the data is drawing. Our members are incredibly dedicated towards studying the use of these tools, ensuring that there is efficacy, that they are trained equitably with data sets that represent patient populations they should be used on. And so as I mentioned, we are working on developing these best practices and workbooks to help our members and to ensure that there's regular consensus documents and clinical practice guidelines that can help guide the decision making process. It's important that we're guided by data to ensure that the decisions that are made at the clinical care settings are based on information, not just hunches by members. I mentioned our Jack journals. So as we go through this process, Jack Advances, which is one of our journals, regularly is evaluating digital health tools and utilization, and we're publishing evidence that can help guide the decision-making process. And also, advocacy comes in a lot of different ways. As I mentioned, regularly meeting with industry to understand what's in development, how we may be able to provide resources to help those that are in the cutting edge and developing innovative tools to have access to information that is important for the development of these tools, to the experts that the cardiovascular teams provide and the college has access to ensure, and then also working to inform policymakers, industry, and organizations to help build the frameworks that allow us to use these tools in equitable ways. As much as we would love to think that a lot of this operates outside, we do know that policymakers have a drastic impact on the utilization of these tools. Doctors and industry need to have the proper reimbursement set in place for tools to be utilized. Otherwise, they're just going to be innovations that are fantastic science, but aren't actually utilized at the point of care. You want to ensure these tools have the data behind them to ensure that they're used properly with the right patient population. So these are all things that the college is actively involved in. And that's why I appreciate the opportunity to get to talk to you and to this crowd for a few minutes to talk about the role that the college has in helping to advance cardiovascular care.
Absolutely, Joan. And thank you so much for your time. I really wanted to ask you just one more question, as you mentioned how policy and advocacy is so, so important. And as a policy expert yourself, how do you see the overall impact that policy is going to have in the future of digital health and cardiovascular care?
Yeah, I think, as we look towards the future and how policy can help to impact digital health utilization in the cardiovascular space, I think we as the college are focused on a few things. One, I mentioned the equitable impact, and it's important, despite, rhetoric that is out there today, that tools are used in ways that actually are treating patients for the appropriate populations. We shouldn't shy away from these issues. In fact, we should be backed by science to show that these tools are utilized properly. We also want to ensure that AI and digital health tools are just that. They are tools. The cardiovascular professionals are the ones who should be in charge, and we don't want to have those tools usurping the patient relationship. It's so pivotal that these patients are able to talk and communicate with their care team to make a decision that's in the best interest of the patient, and that clinical care team is the one that's placed in charge of that. So as we look towards policies, these are the things that we're working on to ensure that cardiovascular professionals have access to cutting edge technologies. We don't want to stifle innovation. We want to continue to have progress in the space, but we want appropriate guardrails in place that ensure that these tools are effective and able to help treat patients that are dealing with incredibly severe, cardiovascular disorders.
Absolutely. Well, thank you, Joe, as always, so much for being on our program and sharing your insights today, and telling us a little bit more about the ACC. It was a really great session with you today. If anyone's interested in connecting with Joe, learning a little bit more about the ACC as well, his LinkedIn and the organization is also website is in the chat. Thank you so much for your time, Joe.
Thank you for having me.